My name is Elizabeth, or Lizzie. You can call me either. I'm currently in LAC. Well, I didn't always know I wanted to be a therapist. I think it was a progression. I did go to therapy when I was younger, and that was an impactful experience for me. And as I was choosing, okay, where do I want to go after doing ABA, which was a really great foundational modality, I was like, I think I want to learn other ways to, help treat different things. So I do EMDR as well as ETT, and they're both attachment-based in terms of their theoretical underpinnings. But really what that means is we're looking at it from that lens, right? You're distressed from that lens. And with EMDR, we're really working to revisit those past experiences that might have gotten, right, the sensations, the feelings, the beliefs you took away from that experience about yourself or about the world. We're working to really update those to fit your life better today. So, okay, I am lovable, or, I can trust people. And with ETT, the stimulus is actually light and color and the angle at which it's coming into your eye. And we're using that to match, theoretically, brain waves to help you digest that, right? So the distress might go up and it might come back down to a more adaptive place of like, oh, now I feel accepting. Rather than raging or something like that. I do think it's helpful to hear that it might get worse before it gets better. And I think also that it's just not a one and done. I think there were times in my life I would go to therapy, especially when I was younger, and kind of be like, fix me. I think it was really helpful to hear kind of like setting expectations of like, this is me helping you gain the skills to have a better life. And it's just me doing it alongside you rather than, hey, here's your, treatment, here's your pill, here's your thing. So I think the empowerment piece in my own therapy has been really helpful, and I do try and tell clients that when they're coming into the space, like, what is it? What are we doing here? And how is this gonna look? I am there to do this alongside you. I'm there to, really form a relationship with you and find the best tools and strategies that are gonna help you heal. I would, love to continue working with Spanish speakers. I did work in an immigration law firm for a bit doing that, and I just have a lot of love for that community that exists here in Phoenix, Arizona. I do think my approach is typically pretty warm. I am trying to sit there and make a connection with you first and foremost, and really curious. I try and be pretty authentic with how I am, and if I'm not understanding, or if I'm not getting it, or if there's an awkward moment and things like that, I want to call it out and I want to have conversations about that. But I think also as a therapist, I'll work to challenge you and like have a direct approach with you, because I think that's also what I'm there for, is to say, hey, like, maybe we're not looking at these things, maybe we're not seeing the full picture. How could we change our perspective on this? What steps are really going to help you to move forward and change and see things and feel differently about whatever you're coming in with?